During the pandemic, cancer cases have been going down dramatically, but unfortunately, doctors think this is more because people are skipping their preventative screenings, not because there are fewer cases. I am joined now by Dr. Camelia Lawrence. She is the Director of Breast Surgery at the Hospital of Central Connecticut and Midstate Medical Center. Thank you for being with us, Doctor.
Thank you for having me.
What have you seen? How has COVID impacted cancer screenings?
COVID has really upended our lives, and as it pertains to breast cancer, we've seen a significant decline in the number of patients who are coming in for screening mammography, as well as patients who are presenting for breast-related problems.
Yeah, and because of that, are you seeing perhaps people end up with a more advanced case of cancer because they waited longer than they should have?
Well, that's what expectation will happen. We're not seeing it in real time, but what we suspect is a few months down the line, that's what we'll see. And what that means is delay in diagnosis means a poor outcome because you're finding the disease at a much later stage.
And there are people who are apprehensive about going back to the doctor's office or the hospital. What can you tell us about the safety of going in for screenings?
And understandably so, at the height of the pandemic, the message was stay home, shelter in place. Hartford Healthcare has implemented a rigorous and robust protocol to keep our patients as well as our staff safe. These include practicing social distancing within our waiting areas, frequently disinfecting areas as well as surfaces that are touched. Our staff and our patients are asked to wear face covering, and we screen every single patient that comes to all of our screening facilities upon arrival.
Yeah, and this is, I know the hospitals have good protocols of keeping COVID patients very separate from those who need to go in for these routine screenings, such as a mammogram.
Absolutely. And most of the mammograms are done in the outpatient setting, not at the hospital. But there are specific protocols implemented within our hospital to separate our COVID patients from our non-COVID patients.
I know your message would be if you are due for one of these screenings, call today because you are taking patients and they are doing them.
Absolutely. We strongly encourage you to come on into a facility. We'll be delighted to provide you with the care that's needed. It's so important to be good stewards of our health.
Thank you, doctor. And for more on cancer screenings and treatment, you can head to hartfordhealthcare.org/services/cancer-care. The address right there on your screen.